nose off. Excuse me. I mean, these are 20 people the week before Christmas that just lost their joy. How do you live with that?
How do you? The latest on the shooting here, we'll have some more specifics here in just a few minutes. The grief and trauma is going to last for years, and for some of these families forever. The community of Newtown is it's doing its best, as we heard a few moments ago. It's doing its best to heal. But what can be done to help the young children and families involved in yesterday's horrific shootings? Joining me now from Washington, D.C., psychiatrist Dr. Josh Weiner. Dr. Weiner, I want to start with something that we've been talking about off and on over the past couple of hours here. Gun control, obviously, that is going to be a discussion that is had in Washington, D.C., hopefully over the next few weeks and months. But mental health in this country is not a topic that is discussed, in public at least, a great deal. How much of the conversation should be centered on that?
To me, I think the conversation should actually start with focusing on the mental health aspect. If you want to fight crime and you want to fight the use of guns and violence, you need to start by mental health treatment. You need to improve the access to care that a lot of people have. You need to take a look at what's happening with some of the laws surrounding the difficulty with getting people who really need treatment, getting them the treatment. It's very difficult for somebody in this country to be mandated once they're over the age of 18 to get mental health treatment. I see this in my practice. I see some people who are clearly suffering. They have the potential to be dangerous to others or to themselves, and it's a real challenge to get them hospitalized. So I think you have to start with the mental health issues.
Doctor, another challenge is being able to discern the difference between someone who is simply quiet and shy and someone who is on the verge of doing something like this. How can folks who are watching at home, how do you know? Or can you ever know until it happens?
Well, Craig, I think you make a good point. Sometimes it is really difficult to tell. I think very few people ever anticipate that no matter how ill their loved one may be, that they're going to be the next Adam Lanza. It's very unfathomable to think that somebody that you care about could go on to do something like this. But I do think you have to look at the big picture. If somebody you care about is having writings that are very graphic and detailed, they have severe mental illness, they're abusing substances, or you see that they're stockpiling weapons, obviously you have to take note of that and you have to do something about it.
There are reports that he may have had Asperger's syndrome. There continues to be a conversation, at least in our newsroom, precisely about what Asperger's syndrome is and what it is not. Can you clear up some of the confusion?
Sure. Asperger's is considered a mild form of autism. So it's on the autistic spectrum disorder. People with Asperger's disorder are kids who have difficulty primarily with social skills. They have a hard time reading social cues. They also may be very rigid in their thinking. They're very strict with routines. They get very upset if things don't go a certain way. But I do not think that Asperger's can really be the reason that we're attributing to him doing something like this. I think there's got to be more going on. Yes, he may have had Asperger's, but I think he's got to have other things too. You can have more than one thing going on at a time. So he may have Asperger's, and he may have gone on to develop schizophrenia. So he's at the prime age for developing schizophrenia, which involves delusions, hallucinations, disorganized thinking, and that combination, particularly if it's in conjunction with substance abuse, right, that really could be a deadly cocktail.
You just said you said prime age. What is the prime age for developing some of these issues?
Well, Asperger's or autistic spectrum disorders are typically diagnosed when kids are around 5 to 7 years old. Of course, you're born with an autistic spectrum disorder. This is not something that you develop or catch. It's just something that tends to be delayed in its diagnosis. For something like schizophrenia, for men, the average age of onset is typically in the late teens to early 20s. So he's in the prime age for the development of that. And certainly we know that people who are abusing substances, that tends to pick up in late adolescent years in the early 20s as well.
Dr. Weiner, thank you so much. Josh Weiner, psychiatrist. Do appreciate your insights, sir.
Thank you.